Thanks for joining us for ABC 15 News at 4. I'm Katie Rammel in for Faye Fredericks. Well, this is far from over, but some positive signs this afternoon in the fight against COVID-19 for the second straight week. ABC 15 is diving into the data, talking to those on the front lines about what they're seeing and where we go from here. ABC 15's Cameron Pullum has the details.
I really see how serious this illness really is, because there are people in there who can't breathe on their own, or they're barely breathing, they're struggling. It's like watching people drown without water.
Dr. Andrew Carroll is one of hundreds of local and out-of-state volunteer medical personnel now working inside Valley hospitals.
Before, we've handled patients dying before. It's what we do, is part of our training. But to have so many people die, and to have so many people die of something we can't really do much about, it really hits you morally.
Dr. Carroll was brought in by Banner Health to help with increasing ER visits. Now, nearly 2 weeks in, finding beds for patients is finally becoming easier.
We're starting to discharge patients who have been there for a while. Ideally, we'll start to see the percentage of the number of ventilators being used, the number of ICU beds starting to drop. We'll know we're in a good place when those numbers are consistently dropping over the next 2 to 4 weeks.
Just like after you start a diet and you get that first 5 or 6 pounds off, and you think, whoa, I'm great. This is working so well, I'm going to go have a bowl of pasta. This is not the time to go get a bowl of pasta.
Dr. Joshua LeBaire with ASU's Biodesign Institute tracks the data closely. Daily cases are down, percent positive rate down too, but so is testing.
My sense is that people see the trends and they feel less anxious, so they're getting less tested. And I would prefer that more people got tested at this point rather than less. I think the more testing we do, the more we can identify those folks who have the virus and get them isolated, and that is the way to actually drive the numbers down.
Bars, clubs, and gyms remain closed, but for how long? Dr. LeBaire says masks, social distancing, and avoiding being in groups works, something that must go into any future reopening decisions.
It's a real fear. I mean, I would certainly not put people back in groups without a lot of precaution.
I'm Cameron Pullum, ABC 15, Arizona.